Hi everyone, this is Harshita. Welcome to Dedicates You channel. So today in this video we are going to discuss an important topic, that is hereditary spherocytosis. In the last class I discussed about the basics of the anemia. If you not seen the video, please go back and watch the video first, because it is very basic to learn any type of anemia. So let's start the class. Here it is hereditary spherocytosis. So first let's decode the heading. As usual, hereditary, because it is something like congenital, and it is in 75% of the cases it is mostly autosomal dominant. Autosomal dominant means, so it occurs equally in both male and female. So that one thing that you must remember. Second one is spherocytosis. Normally, as we all know, normal RBC is biconcave in nature. Okay, in this condition you can see the RBC is in spherical shape. The question that we should get is, why the RBC is in biconcave in shape? So what are the proteins or what are the genes that are helping for this shape? So the major genes are spectrin, and some of the proteins. So these are useful for maintaining the biconvex shape of the RBC. Okay. So now let's talk in more detail. First, let's talk about this spectrin. So this spectrin is made up of two chains. First one is alpha chain and beta chain. If this spectrin is affected due to any kind of mutations, then it leads to the hereditary elliptocytosis. Okay. So this is also one of the major membrane deficient anemia. So if spectrin is affected, it leads to the hereditary elliptocytosis. And next one is, for example, RBC membrane. In this membrane, there are some proteins. So let me draw the proteins. So this is the RBC membrane. So these are the proteins of, this is actin, this is band 4.1, this is glycoporin A, this is band 3, this is band 4.2, and this is ankyrin. So these are the protein. So these are the membrane proteins. So if they get affected, it leads to the hereditary spherocytosis. So let's discuss the pathogenesis. For example, there is mutation to any of these genes. Because of mutation, RBC becomes unstable. Okay, so the stability of the RBC will be lost. So this RBC tries to have minimum surface to volume ratio to 20. So minimum surface to volume ratio is 20. So it becomes spherical in shape. Now the story changes here. This spherical RBC will enter the spleen. In spleen, as it is in abnormal shape, they will get trapped in splenic sinuses. So they get trapped in splenic sinuses or sinusoids, because of which we can see extravascular hemolysis. Okay, so normally the RBC lifespan is 120 days, but whereas in hereditary spherocytosis, its lifespan will be 10 to 20 days. Okay, so extravascular hemolysis will take place. So these are the points that you must take to your home. Next one is, the most important things that you should remember is, there will be increased MCHC value. Why? Because it is spherical in shape, there will be loss of water and potassium due to dehydration, hence increased MCHC value. And let's come back to the genes. Ankyrin. So this is the most important gene. This is the most important protein in hereditary spherocytosis, and there are very less chances for the involvement of this glycoporin in hereditary spherocytosis. And the next point is, this glycoporin is the most abundant protein in the RBC. So this is the least likely one to get mutated, and this is the most abundant one. And ankyrin is the most important protein that you must remember in the hereditary spherocytosis. And if spectrin is being affected, then it is called as hereditary erythrocytosis. So it produces more severe defects. Okay, so now let's go into the clinical features. First one, you can see pallor, jaundice and splenomegaly. So these are the general clinical features for any kind of anemias, and there will be increased risk of gallstones. This is the one you must notify. And next one is, you can also observe aplastic crisis due to or because of parvo B19 virus. And you may also observe hemolytic crisis. So this is because of Epstein-Barr virus. Okay, so these are the important clinical features that you must remember. Lab investigations. Lab test. As usual, hemoglobin will be decreased. TLC and platelets will be normal. MCV, MCH will be normal, but MCHC will be what? Will be increased because of dehydration, which leads to the water and potassium loss. And RBC distribution width will also get increased, and reticulocytes will also increase, but in aplastic crisis they decreases. Peripheral smear. So in peripheral smear you can observe spherical shape RBC. So these are the things that you can observe in your peripheral smears. And there are other causes for this hereditary spherocytosis. So these other causes may be autoimmune hemolytic anemias, or maybe due to any burns or blood transfusions. So these are the other reasons to get hereditary spherocytosis. Now let's discuss an important topic, that is osmotic fragility test. So this is an important test that we do for thalassemia and hereditary spherocytosis. So let me tell you in a very brief way. Osmotic fragility test. Okay, for example, this is a beaker and this is another beaker. Here in the two bakers we added RBCs. Okay, in the first one the solution I added is hypertonic and the second one the solution I added is hypotonic. So here the water comes from the RBC to the outside, and the second beaker, for example this is the A1, this is the B beaker. In the second beaker, as the surrounding liquid is hypotonic, the water will enter into the RBC. Okay, so now the normal RBC will get ruptured in 0.45% of tonic solution and hereditary spherocytic RBC cells. They destroy in 0.55% of tonic solution, and in thalassemia they destroy in 0.35%. So if you draw a graph, for example this is 0.1, 0.2, 0.3, 0.4, 0.5, 0.6, 0.7 and 0.8. Thalassemia will get destroyed. This is the normal thing. They get destroyed in the 5.5. And in case of hereditary spherocytosis, they get destroyed in 0.7 like that, and whereas in thalassemia they get destroyed in 0.35 like that. Okay, so this is the normal one. This is the condition we see in hereditary spherocytosis, and this is the condition that we see in thalassemia. Okay, this will be right side, this will be left side shift. So this is all about the osmotic fragility test, but this is not the standard or confirmatory test for hereditary spherocytosis. So the confirmatory test is EMA test, which means eosin 5 Yamlidian test, binding test. So this is the confirmatory step or test for the hereditary spherocytosis, and the treatment is very simple, and the treatment is like splenectomy can be done, as splenocyte RBC stays but anemia is corrected, and peripheral smear of splenectomy you can sometimes see Howell-Joel bodies. Howell-Joel bodies can be seen in hereditary spherocytosis peripheral smear. Okay, so this is all for today. If you're not subscribed to the channel, please consider subscribing to the channel. Dedicates you. This is K Harshita signing off. Thank you so much.